Choosing a surgeon for any intervention is a very important decision, and I think it's crucial for a patient to feel comfortable with a surgeon, that they establish a rapport and that they trust that surgeon, because this is a journey and it's very important that a patient feels that they've been listened to, that their problems have been taken on board and assimilated by their surgeon, and that they've been given all the reasonable and appropriate options to make a choice regarding the timing and type of intervention that they're going to receive. Having made a decision to have a refractive cataract surgical procedure and going past the element of trust, it's perfectly reasonable for a patient to ask specific questions of a surgeon. So, for example, there are national benchmarks for safety regarding refractive cataract surgery. And I have patients that ask me how many surgical procedures I've performed and what my own personal safety parameters are. And sometimes they ask that with a bit of embarrassment and they apologise, but there's no apology needed. I think it's a perfectly reasonable question to ask, and I'm happy to tell them that over a career spanning more than 22 years to date, I've performed thousands upon thousands of these interventions, and that my safety rates are over and above the national benchmarks. So my safety numbers are better than national averages. I think it's reasonable for a patient to make sure that the surgeon performing their procedure at least advises them about the range of interventions that are available to them, whether or not that surgeon performs them. So that if a certain individual decides that they would like this intervention rather than that intervention, particularly relating to toric lenses and multifocal lenses, that they have the information before they proceed with an intervention, and if they want to have something done that a certain surgeon doesn't perform, that they can ask for a referral onwards. So specific information regarding choice, outcome parameters, and that kind of thing are very important, I feel. I invite you to book a consultation in order to determine your suitability for refractive cataract surgery or refractive lens exchange. It's the only way to determine your suitability for these procedures and to have an in-depth discussion regarding the risks and benefits of each of them. I look forward to seeing you there and taking you through the journey to achieving your desired post-operative outcome.